Hello everyone, my name is Naneshwar. My topic is Diarrheal Disease Control Program. Diarrhea. Diarrhea is loose watery stool that occur more frequently than usual. Diarrhea is usually caused by a virus or sometimes contaminated food. Less frequently, it can be a sign of another disorder such as inflammatory bowel disease or irritable bowel syndrome. Diarrheal Disease Control Program. It started in 1978 with the objective of reducing mortality, morbidity and malnutrition due to a diarrheal disease. From 1992 to 1993, the program has become a part of Child Survival and Safe Motherhood Program. At the present, it is a part of NRHM. Component of Diarrheal Disease Control Program. Short term, appropriate clinical management. Long term, better MCH care practices, preventive strategies, preventing diarrheal epidemic, other preventive strategies, sanitization, adequate and safe drinking water, preventing outbreak, surveillance and control program for diarrheal disease. Appropriate clinical management. It includes oral dehydration therapy. The main aim of oral fluid therapy is to prevent dehydration and reduce mortality. Oral fluid therapy is based on observation that glucose given orally enhances the intestinal absorption of salt and water and is capable of correcting electrolyte and water deficit. Content of ORS. It contains sodium chloride 2.6 gram, potassium chloride 1.5 gram, trisodium citrate 2.9 gram, glucose 13.5 gram, water 1 liter. Sodium chloride is required to restore and maintain hydration electrolyte balance. Potassium chloride is required for K+ loss substances. Trisodium citrate, it is a base and correct the acidosis due to alkali loss in the stool. Glucose facilitates Na+ absorption and water to restore and maintain hydration of electrolyte balance. Total osmolality of ORS solution is 245 milliosmoles per liter. Intravenous rehydration. It is only for severely dehydrated patient and patient in shock. Ringer lactate solution. Best commercially available solution, and it supplies adequate concentration of sodium and potassium aride a lactate yield bicarbonate for correction of the acidosis. Diarrheal treatment solution. Recommended by WHO as ideal polyelectrolyte solution for intravenous infusion. It contains in 1 liter of sodium acetate, sodium chloride, potassium chloride, glucose. Normal saline can also be given, but it pours fluid because it will not correct the acidosis and will not replace the potassium losses. Maintenance therapy. After a sign of dehydration has been corrected, oral fluid should be used for maintenance therapy. For mild diarrhea, amount of oral fluid used is 100 ml per kg body weight per day until the diarrhea stops. Severe diarrhea, amount of oral fluid used 15 ml per kg body weight per hour. Chemotherapy. Irrational use of antimicrobials should be avoided. They are indicated in acute bloody diarrhea. They are also useful in cholera, pseudomembranous enterocolitis, and amoebic dysentery. Examples: Shigella species, drug of choice is ciprofloxacin. Entamoeba histolytica, drug of choice is metronidazole. List of commonly used chemotherapeutic agents for specific treatment of infectious diarrhea. Shigella species, ciprofloxacin. Alternative drugs: ofloxacin, ampicillin, salmonella, ciprofloxacin. Alternative drugs are ceftriaxone, cefoperazone, Vibrio cholerae. Drug of choice: doxycycline. Other drugs are ciprofloxacin. Entamoeba histolytica. Drug of choice is metronidazole and tinidazole. Here some drugs used in diarrhea. Maintenance of nutrition. Contrary to traditional view, patient of diarrhea should not be starved. Patient Fasting decreases the brush border disaccharide enzyme and reduces absorption of salt, water, and nutrient. Starving can lead to malnutrition if diarrhea is prolonged or recurrent. Feeding during diarrhea has been shown to increase intestinal digestive enzyme and cell proliferation in mucosa. Simple food like breast milk or half-strength buffalo milk, boiled potato, cooked rice, fruit juices, chicken soup, banana, sago, etc. should be given as soon as the patient can eat. Avoiding fat, high-fiber food and alcohol generally improve the patient comfort. Zinc supplementation. It reduces episode duration and severity, so recommended by WHO and UNICEF. 10 mg of zinc for infant under 6 months of age, 20 mg for children older than 6 months for 10 to 14 days. Treatment of diarrhea. Oral rehydration solution, zinc tablet, nutritious food, cereals, bean, fish, well-cooked meat, yogurt and fruit plus freshly prepared food. Preventive strategies. It includes sanitization, health education, immunization, fly control. Sanitization. It emphasizes on personal and domestic hygiene like hand washing with soap before preparing food, before eating, before feeding a child, and after defecation, after cleaning a child who has defecated, and after disposing of a child's stool. Health education. It is an important job of health worker. It is to prevent diarrhea by convincing and helping community members to adopt and maintain preventive measures like breastfeeding, improve weaning, clean drinking, use of plenty of water for hygiene. Immunization. Immunization against measles is potential intervention for diarrheal control. Measles vaccine prevent 25% of diarrheal death in children under 5 years of age. Rotavirus vaccine. There are two vaccines, Rotarixtium, Rotatectium. Rotarixtium 2 doses scheduled to 2 to 4 month age child, 1 dose 6 week to 12 week, second dose up to 16 week and no later than 24 weeks. Rotatectium 3 oral dose at the age of 2, 4, 6 months. Fly control. Fly breeding is associated with human or animal feces, should be controlled. MCQ. Which of these is common cause of diarrhea? Contaminated food of water, viral infection, intolerance to milk. All are the common causes of diarrhea. Rotavirus is a common cause of diarrhea in children. Nearly all children have been infected by virus by what age? 5 years of old. What are the common preventive measures for diarrhea? Washing hands regularly, avoiding high-risk food, drinking purified water. All are the common preventive measures for diarrhea. What is the main cause of traveler diarrhea? Eating contaminated food or water is a cause of diarrhea, traveler diarrhea. What is the main treatment of diarrhea? Oral rehydration therapy. C option. What are common complications of diarrhea? Dehydration, malnutrition, electrolyte balance. All are the common complications of diarrhea.